Hello everyone. In this video, we're going to be taking a look at an article that was published on January 8th. It's from NBC4 New York. This is just some fucked up shit that they honestly think that they're gonna, by catering to illegals and lying about costs and everything else, that they're actually going to win votes. The only votes they're going to win with this shit are low IQ, low income Americans and fucking illegals. That's it. Oh, God. So, title: New York City Mayor guarantees comprehensive health care for all in historic surprise announcement. Yeah. And they're trying to play it down on the cost. They're trying to... it's... Well, as you'll see as we get into the article here. It's not health insurance. It's the city paying for direct comprehensive care for those who can't afford it or are undocumented, a spokesman said. Let's call them what they are, because you call a spade a spade. They are fucking illegals. All right? Even Chuck Schumer used to say, you don't call them undocumented immigrants. You don't call them immigrants because they are illegal aliens. That's a disservice to those people who actually come to this country legally. And... the reason why they are undocumented is because they are fucking illegal. It's just a play on words. One that needs to stop. It really does. So, let's get into the article here, because they're talking about this taking $100 million to roll out. They're underplaying how many illegals, because the left likes to do that, are in any given location, whether it's the whole United States as a whole, whether it's a city, it does not matter. They like to play down the actual numbers. And when you're not being honest about the numbers, the amount can't be accurate either. It's just a matter of math to figure that one out. Oh, God. So, anyway, New York City will begin guaranteeing comprehensive health care to every single resident, regardless of someone's ability to pay or immigration status, an unprecedented plan that will protect more than 500,000 New Yorkers currently using the ER as primary provider, Mayor Bill de Blasio said. Oh, excuse me. So, anyway, you have this situation where they're just going to go, he thinks he's fucking Oprah. You've got health care. You've got free health care. You've got free health care. You've all got free health care. And just like when she did that with her cars, everyone's going to get fucked in the long run by taxes. Every one of those people that she went, you got a car and you got a car, every one of them had to pay taxes on a supposed gift because it wasn't a gift in reality. This is not a gift to the New Yorkers. This is a fucking screw job. Because it's going to cost way more. Just look at the fact of it's only going to cost $100 million. This is like Ocasio Crazy Eyes Cortez and her Medicare for all. We don't have enough money to cover that. You think a smaller scale in New York City, something on a smaller scale in New York City is going to work? No, it's going to be no different. The only way it's going to continue to go on is because you're going to take more and more money to prop it up. That's the only way it will, and I'm not even going to say succeed. I'm looking, survive? That's not even the right word, but you get the idea. It's not health insurance, a spokesman clarified after the surprise announcement on MSNBC Tuesday morning. No, it's fucking socialized medicine, as in rationed care, as in these people would be better off not having it. And the thing is you're catering to a bunch of illegals with this. Plain and simple. And the reason why you're doing it is you're pandering for votes. When you go, we're going to give this to illegals. You are pandering for fucking votes from people who can't even legally fucking vote for you. Or the Democrats. They can't do it because, why? That's right, they're illegal. They're illegal fucking aliens. Give me a break. This is the city paying for direct comprehensive care, not just ERs, for people who can't afford it or can't get comprehensive Medicaid, including 300,000 undocumented New Yorkers, spokesman Eric Phillips tweeted. Slight problem. There's way more than 300,000 illegals in New York City. They're not undocumented New Yorkers. Okay, to be a New Yorker, you have to be a legal fucking resident of the state, of the city. You're a fucking illegal alien. You're not from there. You're not a New Yorker. There's probably twice that in New York City. 600,000, I would say, would be a fair estimate because they like to half that shit on the national level. Oh, there's only this many illegals in the United States. And then you find out there's way the fuck more than they're claiming. Yeah, it's no different in New York City. At a press conference Tuesday, de Blasio said the plan will provide primary and specialty care from pediatrics to OBGYN, geriatric, mental health, and other services to the city's roughly 600,000 uninsured. Okay, which conveniently 300,000 of them are fucking illegals by their own estimates, which are complete bullshit. So they're saying 600,000 uninsured, 300,000 illegals. So they're literally going to be paying for half the people on this thing, and they're not even legal, just by their own estimates, which I think are completely played down bullshit, like on the note of the illegals. Yeah. Oh God. Yeah. Okay. That makes a lot of sense. Let's see. Half the fucking people are illegal. You're paying for their health care, and you're catering for their votes in the process when they can't even legally fucking vote. Why the hell can't people, regardless of the false left-right paradigm, see stupid shit like this for what it is? All right, I mean, the people on the right are more likely to see it for what it is, but the people on the left, they're too fucking brainwashed, or in a lot of cases, too fucking stupid. They're too low IQ to grasp this. Because I hate to say it, but lower IQ people tend to vote Democrat. That is a fact, because they can't handle self-sufficiency. They want someone to take care of them. And the Democrats are going, we'll take care of you. We'll give you free shit. And they're like, okay, I got free shit? Okay. And they don't realize that it's really not free, that there's a price involved. They just don't grasp that. The city already has the foundation for such a plan, a public health insurance option that helps get direct care to undocumented residents. Fucking illegals, asshole. They are illegal. They are not here legally. They are criminals. All right? When they go in for health care, they should get treated and arrested and fucking deported. Get their quick due process bullshit through, because they've committed a crime, it's clear, and then get kicked the fuck out of the country. That's how it should be. Oh, okay, we'll take care of you. But guess what? You're going back to Guadalajara, Mexico, or you're going back to El Salvador, or you're going back to Guatemala, or Grenada, or any other place. All right? That's how it should be. Treat them and then freaking arrest them and give them their freaking due process and kick them the fuck out after. Because they're guilty of a crime. If you did that, the cost for... You could actually probably provide a public health care option like this. And it would probably... It'd be rougher to pay for it. It'd probably be a little bit easier, but it would still be rough. I mean, you would still have to prop it up and shit, but it wouldn't be nearly as bad. I mean, when you're saying, well, we got 300,000 illegals. Well, we know all of those illegals don't have insurance. So that means out of that 600,000 total, by your numbers, your estimates, half of them are going to be fucking illegals. They don't contribute to the economy. They don't pay taxes. So, yeah. If you kicked them out, you'd only have 300,000 people to worry about that are uninsured. Just a thought. The option will be expanded, the mayor said, and supported with the addition of a new program called NYC Care. Patients who seek health coverage through NYC Care will receive a card that allows them to see a primary care doctor and seek specialty care services, de Blasio said. So they're getting basically the idea of a charge card where mommy and daddy would be paying for it with the government, the city's government, being your parent. Yeah, that's what they're getting at here. They're basically creating that type of system where mommy and daddy are going to nanny you, meaning the state, well, in this case, the city. God. And they're not going to be able to afford this. There's no way. Those who can afford to pay will pay for services on a sliding scale, while those who cannot, or those who can't, will receive free coverage, he noted. Yeah. Nothing is ever fucking free. Someone else would just be footing the fucking bill. It just won't be the illegals. That's all. And the very low income in New York, they won't be footing the bill. No, it'll be everyone else footing it. New Yorkers will be able to access the program through the city's website or simply by calling 311. There will be no tax hikes to fund it, the mayor said. Yeah. You know what that reminds me of? George Herbert Walker Bush, when he was getting to the point of, like, he was going to be running for president. It was, he's looking at his second term, and he's like, shit, I need to con the American people. So when he came up with the idea of taxes and, being confronted on it, they went, read my lips. No new taxes. Now, that's a really bad Bush. I used to be able to do a better Bush. But, yeah, he pulled that shit and conned the American people. Because, he was like, well, I need them to buy into this for now. And before he even ran, he had to raise the taxes to fund his bullshit. Or at least supposedly. And people saw it. That's one of the reasons why he didn't end up becoming president. So here's the deal. De Blasio is full of shit. There will be tax hikes to fund it. Well, he might not be full of shit because he could just create a new tax, and that wouldn't be a tax hike. That would be a completely new tax. But that's the only way they're going to be able to fund this is by increasing the amount of money they got coming in, whether it's through a tax hike of an existing tax or by creating a new tax. It's the only way it's going to happen. And they're still not going to, it's not going to be enough to support it. It's going to be enough to drag it out. It's going to be enough to prop it up. But it's not going to be enough to actually fund what they're going to create for monetary requirements. It's not going to be able to cover that. The programs will include customer-friendly call lines to New Yorkers to help New Yorkers, regardless of their insurance, make appointments with general practitioners, cardiologists, pediatricians, gynecologists, and a full spectrum of healthcare services, his office said in a release. So basically, it's going to create a huge bureaucracy. And any time that the government's involved and there's a bureaucracy involved, everything becomes way more fucking expensive. Yet de Blasio wants to make this sound like it's going to be cheaper and better and faster. I mean, he's basically like he stole the $6 million man thing of cheaper, better, faster, and he thinks he's going to try to, pawn that belief that in regards to healthcare off on these people, and they're going to buy into it. They're not, unless they're low IQ or brainwashed dumb fucks. It's the only way. I mean, hell, another factor to this is he's going to create a bunch of, with these bureaucratic jobs, he's going to create a situation where you're going to have all these Democrats collecting money off of the government tit. They're going to support this even more. This is about getting votes. All right, with the virtue signaling left that would probably get employed by something like this, along with all the fucking illegals, which are the main target of this, because the illegals, they have no reason to vote. Why would you cater to them with this? This isn't about healthcare. This isn't about some supposed human right, which healthcare is not a human right. This is about just getting votes. This is about conning people. This is about getting them to go and vote against their actual best interests. Throw them a little bit here, and we'll friggin' get them to vote for us, and then we'll screw them over on some other note. That's the whole idea behind this. NYC Care is expected to launch in the Bronx this summer and will be available in the other 4 boroughs in 2021, the release said. Okay, and it's going to cost a fucking fortune. I hate to break it to you. It'll cost at least $100 million, according to the release. At least $100 million. They're trying to play it like, oh, it'll be just $100 million, but it's going to be way more than that. Okay, if we can't afford Medicare for all in the United States as a whole, there's no way New York City is going to be able to do it on a smaller scale, especially when by their own numbers, half of the fucking people that are uninsured are illegal fucking aliens. There's no way that they'll be able to afford that. They don't have the money for the funding. Period. We'll put the money in to make it work. It's going to save us money down the line, de Blasio said on MSNBC. No, it's not. Translation on the note of we'll put the money in to make it work. We will keep pumping more and more money into this socialist bullshit, which will not work because it is socialism, and Marxism in all its forms tends to fail, whether it's healthcare or anything else, because the only way you can keep it propped up is by rationing care and by doing other things like that. You know, deciding who lives and who dies. That's how it survives as long as it does. And it's not going to save money down the line because guess what? Government bureaucracy, red tape, everything else, it's going to increase the cost of this. But they don't want to admit this. De Blasio doesn't want to, for sure. None of the Democrats want to either. We're already paying an exorbitant amount to pay for health care the wrong way when what we should be doing is helping them get to the primary care. Now, here's the thing. If they're going into emergency rooms, you're probably not paying for the fucking care yourself already. Unless you're talking about the illegals that got the NYC care or whatever it is. So, yeah. And you're still paying it. You're with the same program. So that's complete bullshit. Oh, you know, we're already paying exorbitant amount to have, you know. So what you're admitting is even with NYC care, it's costing you more than you thought. Okay, good to know. Because that's what you're kind of alluding to when you say that. This has never been done in the country in a comprehensive way, de Blasio said on MSNBC. Yeah, there's a reason for that. It's because socialized medicine is a failed concept. It would never work in the United States. But you see, de Blasio, he doesn't give a shit because he's looking at the fact of he'll lie through his teeth. He'll create this program just to get the illegals to vote in 2020 for a Democrat. That's one of the reasons why they're doing this. Another reason is to get the low IQ people to vote Democrat. You know, low education types, you know, the people who have lower levels of education, the people who have lower IQs, illegals. These are the people that they're targeting with this. More so illegals than anything else. Which should go to show you that the Democrats don't give a fuck about Americans. This isn't about giving insurance to Americans. Half of those fucking people, by their own numbers, are illegals. 300,000 by their own numbers, which is a grossly low estimation, are out of 600,000, which is a grossly low estimation because they don't want to admit the real numbers of uninsured. They don't want to admit the real numbers and the fact that a lot of those uninsured are middle class that tend to be conservative. They don't want to admit any of that. So, yeah, basically you've got 600,000, like I said, low estimate, 300,000 low estimate. So that means half of the fucking people that are going to get this are illegals. You need something like 80% of these people to be working legally and paying taxes. If you go by the idea of how Sweden's socialized medicine works, they need 83% or something like that of people working just to cover like their social programs. And that's if it's only with the Swedes. That's not with all their illegals and their migrants and whatever else you want to call the people from the regions of the world where you have truck drivers of peace. Yeah. So you would need at least 80% of the population working and paying into this. And they're not going to have that. There's no way, no how. Healthcare isn't just a right in theory. It must be a right in practice. And we're doing that here in this city. Well, I hate to break it to you, de Blasio. Healthcare is not a fucking right. It is not a human right. It is not a constitutional right. You are not guaranteed healthcare. You know, free, which is what you're trying to claim here, like type of idea. You're not guaranteed health care. If health care was a right, the founding fathers would have created a constitutional amendment to state it as such. They weren't stupid men. They just understood that you need to take care of your own sorry self. It's your responsibility to take care of yourself. It is not the state's responsibility to do it, which is what you're trying to do here. You're trying to create a nanny state with dependent people that will keep voting Democrat and will stay on the Democrat plantation because they want that free health care. Ain't gonna work. It just won't work. I hate to break it to you. That's what Ocasio-Cortez is looking to do with single payer, with her Medicare for all, which can't even be funded because there's not enough fucking money being taken in. Even if jacking up the taxes like she's talking about, like 70 or 80% for the richest of the rich, you're still not going to have enough fucking money. This is going to be no different. And then I love how they throw at the end here. Primary care doctors are already scarce in many areas, according to Dr. Tamara Moise, who runs an urgent care center in East Flatbush. Well, yeah, they already are scarce. And the thing is they'll turn down Medicare. You don't think they're going to turn this down? What are you going to do? Pass a law that requires them, or an ordinance because it's the city, that requires them, if they're practicing within the city limits, to take this shit? That ain't going to fly. You'll see doctors leaving New York City. They're going to turn down these people because you're going to have the state, or in this case the city, you're going to have them dictating what these doctors can charge, even if it's less than what it'll actually cost to perform the procedure. And it's just going to be all about control, and they're not going to want to be part of it. So they're just going to be like, fuck you, I ain't taking them on. That's going to make it an even larger shortage than they're talking about. This is just one big clusterfuck any which way you look at it. It really is. For the primary care doctors, we will have a large influx of people who did not have insurance who now will, she told News 4. Will we have a large enough pool of primary care doctors to support that? Probably not. Especially when they start seeing how they're going to get fucked by this. Because they're going to be like, well, shit, what incentive do I have to provide care to people who have this NYC care bullshit? They're like, it's not worth my time. It's not worth my money. It's not, it's not worth my taking a hit financially. It's not worth my effort or my energy. And it's just going to be like Medicare. Really is. I mean, this is some ridiculous shit to think that they're going to con all these people to believe that this is feasible. This is a trying to bribe people with 2020. Less than 2 years, with like a year to go. Yeah. I mean, because we're basically at about a year left. We're less than a year. Well, we're about a year, give or take. So yeah, this is about bribing people. Oh God, I think I've covered this well enough. I'm just gonna leave things here because. Oh, God, I'll probably end up, if I talk about this more, sounding like I have Tourette's if I don't already. Anyway, I'm done. If you liked this video, depending on where you are watching it, please give it an upvote or thumbs up. If you want to know when new content of mine hits the internet, don't forget to subscribe to one or more of my social media or video accounts listed here. Also, with YouTube, don't forget to ring that bell. You can find all of my video content on both BitChute and YouTube. This may not be the case with other places I upload to, but I will try to minimize this happening. You are always welcome to interact with me at any of these sites on the list, so feel free to do so. If you have anything you want me to cover in a video, when it comes to news or current events, send it right along to me. I will try to do my best to cover it. As always, thank you for watching.